Welcome to Dr. Mai, sharing medical knowledge, your go-to YouTube channel for insights into health and wellness. Today, we're diving into a crucial topic, malaria. Remember to subscribe, like, and comment below to support our channel's growth and share your thoughts on future topics you'd like us to cover. What is malaria? Malaria is a life-threatening disease caused by a parasite of the genus Plasmodium. This parasite is primarily transmitted to humans through the bites of infected female Anopheles mosquitoes. Though uncommon in temperate climates, malaria remains a significant health concern in tropical and subtropical regions worldwide. Each year, nearly 290 million people are infected with malaria, and over 400,000 die from the disease, with the highest burden in Sub-Saharan Africa, South and Southeast Asia, and parts of Central and South America. Symptoms of malaria. Malaria symptoms typically begin within a few weeks after being bitten by an infected mosquito. However, certain types of Plasmodium parasites can lie dormant in your body for up to a year, causing delayed onset of symptoms. The signs and symptoms of malaria can vary widely and often mimic those of other illnesses, making diagnosis challenging without specific tests. Common symptoms include fever. A sudden high fever is one of the most prominent symptoms. Chills. Shivering and chills often accompany the fever, as the body responds to the parasite's invasion. General discomfort. A general feeling of malaise or unwellness is common. Headache. Severe headaches can occur, resembling migraines or tension headaches. Nausea and vomiting. Gastrointestinal symptoms such as nausea, vomiting, and diarrhea are common. Muscle and joint pain. Muscle aches and joint pains, similar to flu symptoms, are frequent complaints. Fatigue. Extreme tiredness and weakness can result from the body's struggle to fight the infection. Rapid breathing and heart rate. Increased respiratory and heart rates are signs of the body's attempt to cope with the illness. Cough. A dry cough can also occur, adding to the discomfort. Some individuals experience cycles of malaria attacks, beginning with shivering and chills, followed by a high fever, and concluding with sweating and a return to normal temperature. When to see a doctor. Seek medical advice if you develop a fever or other symptoms of malaria, especially after traveling to or residing in a high-risk area. Early diagnosis and treatment are crucial for preventing severe complications. If symptoms are severe, seek emergency medical attention immediately. Causes of malaria. Malaria is caused by Plasmodium parasites, with 5 main species affecting humans: Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malaria, Plasmodium knowlesi. Among these, Plasmodium falciparum is the most dangerous and responsible for the majority of malaria-related deaths. The mosquito transmission cycle. 1. Infected mosquito bites a person. A mosquito becomes infected by biting a person already carrying the malaria parasite. 2. Parasite transmission. The infected mosquito can then bite a healthy person, transmitting the parasites through its saliva. 3. Parasite maturation in the liver. Once in the body, the parasites travel to the liver where they mature. Some types can remain dormant in the liver for prolonged periods. 4. Infection of red blood cells. After maturing, the parasites enter the bloodstream and infect red blood cells, where they multiply rapidly, causing the symptoms of malaria. 5. Continued spread. An uninfected mosquito that bites an infected person can pick up the parasites, perpetuating the cycle by spreading the infection to others. Other modes of transmission. Malaria can also spread through exposure to infected blood, including from mother to unborn child, blood transfusions with infected blood, sharing needles contaminated with infected blood. Risk factors. Living in or traveling to areas where malaria is common is the most significant risk factor for infection. The risk varies based on local malaria control measures, seasonal fluctuations in malaria transmission, and personal precautions taken to avoid mosquito bites. Key high-risk regions include Sub-Saharan Africa, the region with the highest malaria burden; South and Southeast Asia, including countries like India, Myanmar, and Indonesia; Pacific Islands, areas like Papua New Guinea and Solomon Islands; Central and Northern South America, regions such as the Amazon Basin. Risks of severe malaria. Certain populations are at higher risk of developing severe complications from malaria, including young children and infants, due to their underdeveloped immune systems; older adults, Age-related decline in immune function increases vulnerability. Travelers from non-endemic areas. Lack of prior exposure means no immunity. Pregnant women and unborn children. Pregnancy reduces immunity, and the parasite can affect the placenta. Complications of malaria. Malaria can lead to serious, life-threatening complications, particularly when caused by Plasmodium falciparum. Some of these complications include cerebral malaria. Infected red blood cells can block blood vessels in the brain, leading to swelling, seizures, and coma. Breathing problems. Fluid accumulation in the lungs can cause severe respiratory distress. Organ failure. Malaria can cause the kidneys, liver, or spleen to fail, leading to potentially fatal outcomes. Anemia. The destruction of red blood cells can cause severe anemia, impairing oxygen delivery to the body's tissues. Low blood sugar. Severe malaria and certain treatments like quinine can cause dangerously low blood sugar levels, potentially leading to coma or death. Malaria may recur. Some malaria parasites, particularly Plasmodium vivax and Plasmodium ovale, can persist in the liver for extended periods, causing relapses months or even years after the initial infection. Prevention of malaria. Preventing mosquito bites is key to avoiding malaria, especially in high-risk areas. Here are some effective prevention strategies. 1. Protective clothing. Wear long-sleeved shirts and long pants, especially during peak mosquito activity between dusk and dawn. 2. Insect repellents. Apply insect repellent containing DEET, picaridin, IR3535, or oil of lemon eucalyptus on exposed skin. Avoid using OLE or PMD on children under age 3. 3. Treated bed nets. Sleep under insecticide-treated bed nets, which provide a physical and chemical barrier against mosquitoes. 4. Insecticide-treated clothing. Use clothing treated with permethrin, a safe insecticide that repels mosquitoes. Preventive medication. If you're traveling to a malaria-prone area, consult your healthcare provider about preventive medications. These drugs, which are often the same as those used for treatment, can be taken before, during, and after your trip to reduce your risk of infection. The choice of medication depends on factors like your destination, length of stay, and your health status. The malaria vaccine. In a landmark advancement, the World Health Organization has recommended the use of a malaria vaccine for children in high-risk countries. This vaccine offers partial protection and, when used alongside other preventive measures, can significantly reduce malaria infections and deaths. Researchers continue to explore new vaccines and other innovative strategies to combat this global health threat. Malaria is a preventable and treatable disease, but it remains a formidable challenge in many parts of the world. Awareness, preventive measures, and timely treatment are crucial in reducing the burden of this deadly disease. Whether you live in or plan to travel to a malaria-prone region, staying informed and taking the right precautions can save lives. Thank you for joining us on Dr. Mai Sharing Medical Knowledge. Don't forget to subscribe to our channel, like this video, and share your thoughts in the comments. Your support helps us continue to bring you valuable content on health and wellness. Stay safe and healthy, and we'll see you in the next video.